Hi guys, I just want to share a little story with you guys today. I witnessed something that was terrible. At least from my point of view, I felt like it was really just something that could have been avoided. Somebody's feelings were really hurt and there was just no need for it. I was in the optometry office today waiting to get my glasses, and this beautiful woman came in. She was dressed immaculately. Had her hair done, she had her makeup done, she had beautiful nails on. She was just beautiful. She came in and she checked in to see one of the optometrists in the office, and she said her name was Sally. The receptionist asked for her ID and insurance card, and on her ID and insurance card, it had the name Stephen. Well, the receptionist refused to say ma'am, refused to say Miss Sally. The receptionist kept calling her by Stephen and saying, "Excuse me, sir, here you go, sir." You could tell that the receptionist was doing it out of spite, just to hurt Sally's feelings, and it really just killed me. I just wanted to share some stuff with you guys. Sex and gender are something that is totally different than it used to be in the past. In the past, everybody had a clear picture of sex and gender. You played the role of the sex that you were born with. Whether you felt that you were a woman or not, if you were born a woman, you stayed home and you raised kids. You cooked dinner. You catered after a man. If you were a man or if you were born a man, you went to work every day. No matter if you felt like you were feminine inside or like you should have been born a woman, that didn't matter. It wasn't questions back then. Today, we see gender. We see gender as a continuum. Gender is who you are and how you feel. It doesn't have to do with your genitalia. It's not a biological difference between a man or a woman. It's who you are. Sex is the biological difference. It's whether you were born with a penis or a vagina. It's what hormones run through your body. But gender is something different. It says who you are, who you identify with. Women obviously are born with different chromosomes than men. Women have XX chromosomes while men have XY, and different hormones. Women are born with estrogen. Men are born with testosterone. That doesn't mean that you identify with that. Some men are born with low testosterone and they identify with women. They feel that they should have been born a woman. And that is not for anybody to say. It's not for me to say how you should feel. It's not for a doctor to say how you should feel. It just is. It's who you are. Males, I've heard that males are really the weaker sex. They say that women give birth. We're so much stronger than men. We frequently request health care. We seek a doctor's, we seek going to the doctor for anything that's wrong with us. If we get sick, we're in the emergency room or the urgent care. We're more in tune with our emotions. If we feel like we're having an off day, we're not ashamed to go to a doctor and tell them that we need medication, or seek the help of a psychiatrist. We also have a huge support system. Women are known for speaking. Women get together and gossip, but it's not just gossip. It's us venting. It's us getting emotions and worries and excitement and joy and everything else off of our chest, or expressing it out of our bodies. It's us talking to somebody, anybody that we can, really. My psychiatrist is my nail girl. I go and I get my nails done and I speak to her about everything. She knows my life. She knows everything that I've been through. She's my psychiatrist. I always tip her really good because she's great with that type of stuff. But men, their hormones make their metabolism a lot weaker than women's. They hold on to work stress and the lack of a support group. They hold it all in. They don't let it out. Men have riskier behavior than women's. a lot of men have a lot of aggression and turn to violence to let go of a lot of their stuff. They hate to ask for help. They hate to ask for directions. They hate to ask for medical help. Let me tell you. So that's a difference between men and women, and it's something that causes a lot of problems for men. Women, they feel a lump in their breast, they go to the doctor right away. Man, he feels that something is growing on his body. It's a huge lump. He knows that it hurts, but he doesn't want to seek help for it. He's either ashamed or, he's a man. Oh, it'll go away. I'll be fine. Whatever. That's not the case. It causes for a lot of healthcare problems with a lot of men. Gender identity, like I said before, feeling that you're a woman or a man, not with the sex that you were born with. It causes a lot of challenges in healthcare for a lot of professionals and a lot of patients. It causes a lot of mental health issues for the patient. A lot of people that identify with a different gender than they were born with, they have a lot of suicidal tendencies. Some of them have self-harm issues. They cut themselves, they burn themselves, whatever the case may be. A lot of them have substance abuse issues. They turn to drugs or alcohol to get rid of the feelings of not knowing who they are or not accepting who they feel they should be. A lot of them are victims of violence. They get discriminated on. A lot of them delay seeking care from a healthcare professional because they're ashamed or because some of them don't have health coverage. Some insurance agencies don't want to give coverage to people that identify with a different sex than they were born with. Gender identity, it causes negative experiences in healthcare for most of the patients. 19% of those patients, like I said, are uninsured. They don't have coverage. If anything were to happen to them, they couldn't go to the doctor. If they were to find a lump somewhere, they couldn't go to the doctor. Or if somebody was to physically harm them, what if somebody jumped them because it's a man dressed as a woman? He couldn't go seek help from any healthcare provider because he's uninsured. 50% of gender identity cases have to teach their provider about gender identity and what it's like to, be a woman living inside of a man's body or be a man living inside of a woman's body. 19% of those gender identity cases refuse care because they are scared of discrimination. 28% postpone care because they have been discriminated upon. Knowing gender identity and sexual orientation of patients is a vital aspect of medical care. Now, it's as simple as asking what they identify with. It's as simple as educating yourself on what you should do for people that, identify with a different sex than they were born with. It's as simple as taking a training class on how to address them. Should I address them him or her, or should I address them, with whatever they feel, however they feel? It's just something that we can definitely make a difference. So we can treat these people. They are patients. They do need medical care just like the rest of us. And it's as simple as listening.